Hiya. Hi, Leah. Hi, Chris. Hi there. Hi, Charles. You are very, very on time and prompt today. Yes, I am really well, thanks, Chris. I sort of feel like I've been off the radar a little bit over the summer. You know what it's like? You just get so like caught up in kids' school holidays and, you know, catching up with family stuff and trying to dodge the rain clouds. So I feel like I can get back into the swing of things again. Don't know if anybody watched the Lorraine show this morning. I was obviously such a sad topic to go on to talk about the fact that Sarah Harding passed away, but it's a great opportunity to be able to sort of push the message out about, you know, being body aware and everything. So it was good in that respect, you know. Right. Charles, I'm going to send you an invitation, hon. See if you can come on and join me. God, is anybody else absolutely sweating today? Hello.
Hi.
How are you?
I'm all right, thank you. How are you?
Yeah, really well, thank you. It's so nice to see you.
Oh, thank you. And you?
Oh, yeah.
So I've been in Lorraine, actually. Well, I said I saw you this morning. I'd like to say I saw it live. I was actually still in bed, but I did catch up on it afterwards. So,
do you know what? If I could have been in bed when that was on, I would have been as well, to be honest. Oh, no, it was, I was just saying, actually, it was, you know, a bloody tragic situation with Sarah Harding. But it's a great opportunity. That sounds wrong, but do you know what I mean? It's a good, it allows us to be able to say, please everybody check yourself, to, you know, and it's a shame that I was on those circumstances, basically. But you know, at least something positive could be done today to talk about it even more, you know. And something I'm trying to do on the C list, which I do over on the Titty Gritty, Charles, and I don't know if you know this or not, is that I'm trying to each month sort of shine a light on different cancers, because I know that obviously breast cancer gets quite a lot of focus. And I just wanted each month to talk different cancers. And September, I looked it up, and it was Gynecological Cancer Awareness Month. Not that we should just talk about it in September. I know I say it every time. We should always be aware of things. And I know I've connected with you before in the past, and I thought, I wonder if you might be feeling, you know, well enough to come on and sort of share your story and hopefully spread a bit of awareness, you know, about what you've been going through and how it's been for you. So
go on, sorry.
So I was just going to say, can we just go back to, you know, when the symptoms started and what were they? And
so it was back, I was actually diagnosed in October last year, and it was probably back in July, August time. Now I don't have any bleeding whatsoever, so I was on the continuous pill, don't have any breakthrough, any spotting, anything like that. So the main thing to remember is it's what's normal for you. So what's normal for you isn't necessarily what's normal for everybody else.
So true.
Like for me, I knew straight away. So I actually had an episode of bleeding after sex, and that for me straight away was red flag. It shouldn't have happened. It's never happened before. I don't bleed, don't have any spotting, nothing like that. So I thought I'll keep an eye on it. I'll see if it happens again. If it happens again, I'll go to my GP or ask for a bit of advice, and I'll see what happens. And it didn't happen again, probably till about August time. And then middle of August, toward the end of August, it happened again. And I thought, right, that's it. I'm going to get this checked out now. And it just so happened that I think that weekend I was actually on a weekend away. I think I was in Liverpool for the weekend. So I was staying over, and it was actually when I got home, there was a letter waiting for me saying that your smear test was due. So
what, coincidentally?
Yeah, exactly. In my mind straight away, I'm thinking, this can't be a coincidence.
This is too spooky, Yeah,
and it does, it freaks you out, because you read this letter and you think, oh my God, like after what I was saying last night, all of a sudden I've now got a letter saying that the smear test is due, and I'm thinking that can't be coincidence. And you know, I've never missed a smear before, and I rang up straight away the next day and I got it booked in with my GP, and I actually got my smear appointment quicker than I could get an appointment to see the GP about the bleeding.
Oh my God, what are the chances of that? Because this was during lockdown, wasn't it?
It was, yeah. And it was almost, it was like the second lockdown. So I think things have lifted a little bit, but nowhere near as much. And I think it was like, you know, when the bars had just opened and it was sort of eat out to help out. I think it was around that time that I started having the bleeding.
Oh, and was it painful as well during sex, if you don't mind me asking?
No, I didn't get any pain. And, you know, I've spoken to my friends afterwards and they've all said to me, you know what, Charl, if I had what you had, I wouldn't have even bothered getting it checked out. I wouldn't have even thought that it was anything that I needed to get checked out.
Yeah. And was it, and I hope you don't mind me asking, but was it a lot of blood or just a little bit? Or was it
almost as if it was as though I was coming on my period. So, you know, when you first come on and you get that initial bit of blood, it was exactly the same. But again, because I know that I don't have periods, I knew there was something to look for. Whereas, like one of my friends would say, well, I have periods, so I just thought that maybe I was coming on, or that I was spotting in between, or you know, they would never think anything of it. It stopped straight away as soon as I had the bleeding. It stopped as quick as it started. And again, for me, I was thinking, well, if it was, you know, if I was in that situation, it was maybe starting my period, it'd continue, it wouldn't stop. And that's, again, you know, you'd notice that, you'd see it.
Yeah, you would, absolutely, you definitely would. Can I ask, how old are you, Charles?
31, so nearly 32, 32 this month, actually.
So young as well, isn't it?
I know, it was just before my 30th birthday that I started having the symptoms, and then I was just turned 31 when I was diagnosed.
Right. So you had your smear, and then how quickly after the smear did you get a call back?
So I had the smear, and when I went for the smear, obviously I told the nurse who was doing the smear what I'd experienced, and this is the only sort of, out of the whole journey, seeing different doctors, different specialities, the only time I've ever really felt, I wouldn't say let down because I think that's a harsh word, but maybe where I wasn't being taken seriously was when I went for that smear. So I told the nurse what I was experiencing. I told her the bleeding that I'd had, and she kind of said, well, I'll wait for your smear results to come back and then we can speak to the doctor afterwards. And I just didn't feel like things were being taken seriously. So I've luckily got a friend who, because I'm a nurse myself, and I've luckily got a friend who is a practice nurse. And I said, you know, if this was happening to you, would you maybe push for something to be happening sooner? And she said, yeah, 100%. And I rang the GP back and I told them, and I said, I'm not happy to wait. And especially with it being in coronavirus, the waiting times were a lot longer than normal. So it was about 6 weeks, and I thought, I can't wait 6 weeks for a smear.
Was it really? Oh my goodness. I assumed it would be like a week that you'd have to wait. So they were saying about 6 weeks.
Yeah, I think like normally it is around a week or so. But yeah, at that point, I think with coronavirus and everything that was going on, it was 6 weeks at that point. And I thought, I can't wait 6 weeks. Do
you know what? I don't think I would have had sort of announced to do that, to actually pick up the phone and, you know, get it pushed forward. So absolute like credit to you for doing that. And it shows how important it is to do that.
Yeah, it does. I wouldn't usually, and I always say to my friends, like, I'm a typical Libra. I don't like confrontation, and I don't like calling people out, and I don't like picking up the phone and saying, well, actually, I've just spoken to a nurse and I think she's wrong, and I think my nursing head is better. And I don't like that, and I'm not usually like that. And I think that was looking back at it now, I think that was another reason why I knew that there was something wrong, because it's almost like intuition in a way. And
just shows
say,
you've got to go with your gut, doesn't it?
Yeah, 100%. When people say, like you do know, I knew straight away there was something wrong with my body.
Yeah. Do you think being a nurse sort of helped you in that respect as well, in terms of taking it seriously?
Yeah, possibly. I think so. Initially, we're getting checked out, knowing that the bleeding that I was having was abnormal, because I think if I wasn't a nurse, I probably might have sidestepped it a bit longer. Probably would have had a few more times before I bothered doing anything about it. Whereas I think because I'm a nurse, it pushed me to get checked out straight away. But I've learned so much since being diagnosed that I didn't even have a clue about. I didn't even know about before. And, I always say, just because I'm a nurse doesn't mean that I know these things anyway. Since being diagnosed, I've discovered all this stuff that I didn't know anything about before. And I've done a lot of research as well, Again, that's just the nursing side of me. I've done a lot of research as well. But there's been a lot of stuff that I've learned that I didn't have a clue.
And so you were given your diagnosis, and at that point you had a sort of treatment plan, didn't you, given to you, and you were put onto chemo throughout, during lockdown, wasn't it?
That's it, yeah. So initially they thought that my cancer would actually be small enough for them to just do surgery. So they thought that they'd be able to do a full hysterectomy. It's a little bit more than a hysterectomy, so they call it a radical hysterectomy. So it's taken out some of like your tissues and your muscles and things around, so it's not just straightforward hysterectomy. And they actually thought that the cancer would be small enough for them to just do that. And then once the PET scan come back and the MRI scan, and they looked properly, and they said that it had actually spread to my lymph nodes. So surgery wasn't an option at that point. That basically means that the cancer's too advanced. So they said, you're stage 3 at this point, and we need to go ahead with chemo and radiotherapy instead of the surgery. Which at the time, I think I thought that I'd be better mentally with the chemo than I would with the surgery. Because in my mind, I thought, well, with the surgery, I'm going to feel well once I've had the surgery done. And it's the whole 12 weeks of not driving, 12 weeks of not even being able to pick a kettle up, that I didn't think I'd cope with that very well. And I thought that the chemo...
It's massive surgery, isn't it?
Yeah. Looking back now, I was probably a bit naive as to what the chemo entailed. But my dad's had stage 4 cancer before. So I kind of spoke to him and said, you know me better than anyone. And he kind of thought that I'd, again, mentally deal with what I'm going through now better than I would do the surgery. And I do agree, to be fair.
Do you still agree with that?
Yeah. I do think I probably am better suited to what I'm doing. But when they told me I couldn't have the surgery, I don't know why I felt kind of relieved in a way. Not because I wasn't having the surgery, but more because there was a bit more of a solid plan. Whereas before it was a little bit, if it comes back as this, we'll do this. If it comes back as that, we'll do that. And it was if and an R-ing for me. And I was like, well, I need to know what the plan's going to be.
Probably felt a bit more practical for you, like something to kind of focus on.
Yeah, exactly. But the initial, what else threw me with that as well is they were saying, if it comes back as this, then we'll do the surgery. And it was like within days. And I was thinking, I haven't got time to prepare for that. Like, I haven't got time to prepare for not being able to drive and like taking the time off work. And I thought, oh, I'll go for chemo, I'll have my bad week, and I'll go for work in the weeks in between. Yeah, I thought wrong.
You definitely thought wrong there.
But I got my diagnosis on the 15th of October. I didn't actually start. So my first chemo session was Christmas Eve. So I
Happy
started my
Christmas.
chemo
Oh my God.
and radiotherapy the week before Christmas.
So that's quite a long gap, isn't it?
Yeah, there is. So I was quite lucky that I was able to have my eggs frozen. So when I got
Okay.
the diagnosis, they
Yeah.
referred me to Birmingham Children's Hospital. So I'm actually in Stoke, but they
Oh.
were referred to Birmingham, which is the next specialist hospital to me.
Hmm.
And I went down there. I had to go and have sort of all different
Yeah.
injections. I was doing them myself at home. That was for 2 weeks. Then I went and had the actual procedure, so having my eggs taken and frozen. And then I had to go for a few more scans. So they initially thought that I might have something on my liver, so something showed on the MRI. But when I went for an actual liver MRI, it was something benign. It was something.
Oh, okay.
They kind of said, it doesn't need investigating. And I think because of those extra scans and because of the egg freezing, and then I had to go for a radiotherapy planning scan as well, which was another delay. And well, it's not a delay, but it's just another thing that needs doing.
Yeah. There's a lot involved, isn't there? Getting ready for it. So they did your eggs.
Yeah. So
Was that a success?
Yeah. So
Okay. That's
I
good.
brewed 14 eggs. But
that's quite a good amount, isn't it?
It is a real good amount, yeah. But they weren't all mature enough to be frozen. So I froze 6. So I've got 6 of them there if I need them. I won't be able to carry a child myself in future, but if I need them, then they're there to use a surrogate for. So.
Yeah. I've got a good friend that did that after going through breast cancer treatment. Yeah. And she had her first via surrogacy, and then they decided to go in again.
Oh my God.
And they ended up with triplets. So they've now got 4 babies. Yeah. And they, it's a tough journey. I should hook you two up. She'd give you loads of advice.
That's incredible.
Yeah, really, really, so inspiring and amazing that those options are out there and available to you.
Yeah, well, this is the thing, because if I do go down that road in the future, touch wood, I'm here to do so. And if I do go down that road in the future, then it's another journey, because it's like, making sure the eggs survive being depleted almost. And actually survive going through the whole process. So that's another journey, I can imagine.
So you started treatment on Christmas Eve?
Yeah, so it was the week before Christmas I started my radiotherapy, and my chemo was actually Christmas Eve. So I had 5-6 weeks worth of treatment. I had radiotherapy every day. So I was going to the hospital every single day, radiotherapy. And then I had chemo every Thursday, so every week.
So you had it at the same time then? So on a Thursday you'd have chemo and radio?
Yeah, so I'd basically go up to the chemo ward, have my chemo, and then as soon as I was finished, I'd go downstairs to radiotherapy and have radio.
Oh my gosh.
Day. Yeah.
That's intensive.
It was intense.
How did you feel?
I felt like the radiotherapy knocked me more than the chemo did. I was really sick from the radiotherapy when I first started getting it, and the nurses were like, "Oh, you don't feel side effects of radiotherapy for 2 weeks," and I'm like, "Well,
I can feel it.
I can say otherwise when my head's down the toilet. Trust me, I'm getting the side effects."
So when they do the radiotherapy, are they targeting your sort of groin area?
Yeah, so you have to go for before, so that's, I presume, like a 3D image of where they're going to be targeting. And then every day you have to drink so much water to have your blood so full. And your bladder has to be the same size almost every day.
Oh my goodness. Yeah, because I guess they have to keep matching it up so perfectly, don't they?
That's
How
the thing.
on earth do you do that? So you have to time it probably and have the same amount of water. Oh my God.
So you basically have to drink what you think is the same amount of water every day. So they usually say 500 mils. So you have to wake up an hour before your radio session.
Yeah.
Empty your bladder completely.
Yeah.
Drink X amount of water. So for me, it was about 700 mils. Then not go for a wee again. So you have to hold that in till you get to your appointment. And then they
God.
On you, so to see how much urine you've actually got in your bladder. If it's enough, then they can do it there and then. If it's not enough, you have to go back up to the waiting area and drink some more. Or if it's too much, you then have to go to the toilet, let out half a wee.
Oh no!
I don't know.
I could. Oh my God!
Have another bladder scan if it's the right amount, perfect. But then you get into the sort of realms of I've emptied too much. So then I've got to go back in the waiting room, drink more again, and yeah, getting that target.
I honestly think that would just tip me over the edge after everything else that you've got on your plate with the chemo and everything else. Then to, oh my God.
Yeah, and it was the drinking of the water that got me.
Bet.
So your toast goes completely. So your toast is metallic.
Yeah.
And you sort of sat there drinking this water whilst feeling sick. It's 7 o'clock in the morning, and you've got to start drinking sort of nearly 2 pints of water at 7 o'clock in the morning, and it's not what you want to be doing. It's horrendous.
It's really not what you want to be doing, and you're on your own as well, aren't you? Because presumably you didn't have like a partner or anybody with you.
Nobody with you. You have to go to every appointment on your own. I was on my own when I was told that I had cancer. I was on my own when I went for my appointments, my scans, planning sessions, sort of actual treatment like radiotherapy, chemotherapy.
And how
long as well? I was sat in a chair for sort of 6, 7, 8 hours. So you have to keep yourself occupied.
Yeah, and so how do you feel that's affected you mentally, doing all that by yourself?
Yeah, I feel like it's taken its toll. I feel like at first you don't sort of grasp what's happening, and you don't feel as if it's happening. And when I was going through that treatment, I kind of just got my blinkers on, did what I did, and then just got through it. And then it's not until you finish the treatment that you kind of think, actually, what have I just been through? You know, what have I just done?
Yeah. So when did you finish the chemo then? That was February, was it?
Yes, I finished chemo in February. Well, it was probably January actually that I finished my chemo.
Right.
And I had sort of like a 2-week break, and then I went in for internal radiotherapy. So it's called brachytherapy.
Internal? Oh my God, really?
Oh God, it's a nightmare. So you basically go in, they admit you for either 2 or 3 days.
Yeah.
And then you have an epidural, so like a spinal block.
Yeah.
And completely numb you from the waist down. They sort of have your legs up in these little stirrups.
Yeah.
And then they insert what can only be described as a Meccano kit. It's like metal rods that go inside you. There's 3 of them, and they kind of sit.
Wow.
This. And they insert the rods. They do connect the rods up to a radiotherapy machine, and then that gives you directly internal radiotherapy. You then go up to the ward for sort of 24 hours overnight.
Yeah.
Come back down the next morning, do the same. Well, the rods stay in place.
And do they keep the epidural topped up so you never?
No.
Oh, so then that wears off.
Yeah, so you just have a spinal block and that's it. So once that block wears off, it's just normal pain relief that you can take.
Oh wow. And then you have to go back down the next day and you do it again.
Yeah, so you do it again the next morning, and then you go back up to the ward for a few hours, then you go back down. I think it was about 4 or 5 o'clock I went back down and had the last session, so it's 3 sessions in total.
Oh man.
Yeah, it's
that is intense. I did, if I'm honest, I didn't even know that existed, internal radiation. It was just
and it's the worst. Like, people always said to me as soon as I was diagnosed, you reach out to people on Instagram, you get talking to all these people that you existed before, and then people always used to say to me, the brachytherapy is the worst bit, like be careful with the internal, that's by far the worst. So all the way through I was like building myself up for this thing that's going to be horrendous, and it's going to be the worst thing ever, and it still was the worst thing ever. And part of me thinks, if I didn't know that, and if I hadn't built myself up, how much worse would that have been for me? If it was already horrific, how much worse would that have been?
There are lots of people commenting on it on here, like saying how awful it was, and it just sounds unimaginable. So you were in them for 3 days, and then you came home, and then was it a scan or something? Because technically you're sort of end of treatment at that point. Presumably.
So I rang the bell that day, after my brachytherapy. I went downstairs and I rang the bell, and everyone was there who'd done my radiotherapy, because obviously they treated me every day. So they were there, and the girls who'd done the brachy were there, and I rang the bell, and they let my mum come in to see me ring the bell.
Oh, amazing.
Yeah, my mum filmed it, and we were crying, and we went home and we had some drinks, and we didn't celebrate as such because we didn't know whether it had worked or not, but we kind of celebrated getting through what I got through, So at that point I was waiting.
You've got to take those small wins, right?
That's it.
Yeah.
Any positive is a positive, and as long as you can, there's always a positive in every situation. Like, even if it's a really bad, god awful situation, there's always a positive. Like losing your hair, well, it doesn't take us long to get ready in the morning. There's always a positive to everything. And
so true.
At that point we were taking the positive, and we were taking sort of the milestone that I'd finished that leg of treatment. If more treatment come, then that's the next leg, but I'd finished that leg, I had a little bit of a celebration, and then I was meant to be waiting 12 weeks for a scan, and everybody that I speak to says that 12 weeks is just horrific. It's horrendous. You sit and you wake up and you kind of think, am I cured of cancer? Because I've kind of celebrated the end of my treatment. But then I'm not getting on with my life, because I'm kind of stuck in this limbo stage where...
Why is it a 12-week wait?
They say that if they scan you before the 12 weeks, it could potentially show up scar tissue, and the scar tissue could make it look like cancer when it isn't. So that's the reason why. For me, I started getting really bad hip pain. And I broke my hip before. A couple of years ago I broke my hip just getting out of the hot tub. I slipped on some decking, I fell.
So this was like before any of your diagnosis? This was like years ago?
God. It was about it was 2 years ago. So
you just thought that was connected maybe to when you broke your hip, did you? That it was that?
They said to me, your radiotherapy is going to weaken the bones in your pelvic area, so sort of breaks and things can come a lot more easier. And they'd even said that like stress fractures, so just the fracture of putting pressure through your foot and your hip could cause a fracture as well. So when I started the pain, I just thought that I'd maybe stress fractured it, because I'd been doing loads of walking with the dog, and I just thought, like, I need to kind of get going and take my mind away from this 12-week wait. So I was doing quite a lot of walking and hiking and things, and I thought, well, maybe I've done too much and I just need to take it back. I kind of tried to cool down and just say, take a step back. But then you kind of get this, again, intuition. You get this thought and you think, actually, I think it might be something else. So I actually went and got my hip x-rayed, and that come back as nothing. So I thought, well, if the x-ray's clear, then surely that must be good news. And they referred me to the orthopaedic specialist 2 weeks later, just for a telephone consultation, so just so they could ring me, see how I was getting on, see if it improved. And they rang me, and it actually got a lot worse. It had progressed. So I'd gone from walking with no crutches to walking with one crutch to not even being able to take a step without but 2 crutches.
Wow.
And for me, I just knew it at that point, when it had gone from not needing any crutches at all to walking with 2 crutches, like, it's a progression, it's not something getting better. And if it was a fracture or an injury, I would have seen myself getting better. And I wasn't getting better, I was getting worse. And I think for me, that's how I knew. The orthopaedics, obviously, when they rang me and I told them this, they arranged for a scan for me. So I went for the scan, I went for the MRI scan, and then they had me back the next day. And I thought, I've never even heard of anybody getting results that fast.
I've never heard that.
The next day is,
So when you had that call to say, come in tomorrow, you must have thought, well, this can't be,
I knew it wasn't good news. It was the same with my initial diagnosis.
Did they let anybody come in with you?
No, I was on my own again.
Gosh, I don't know. It's just so unbelievable that you've had to do that all by yourself. So then what did they say to you?
I think I told them more than they told me. Like, I already knew that it was in my hip, and I kind of went in and I sat down and I said, it's in my hip, isn't it? And they said, yeah, you've got a large tumour at the top of your hip. So if you imagine sort of like the ball and sockets, where I broke previously, it was like the socket side, and it was actually the ball side that had the cancer. So the whole ball, and then coming down my thigh bone was cancer. And they called it a large metastatic tumour. My consultant was so sort of flabbergasted about how quick this tumour had come. She actually went back in the MDT meeting the next week and looked at all of my previous scans, because they thought there might have been something there that they just missed.
That maybe they missed it,
so much. And they went back
and they didn't. They couldn't find anything.
Nothing there at all. And she rang me and she said, look, Charl, I'm really sorry, but there was nothing there. So we know that this cancer now is really aggressive, because when we did your scans for brachytherapy in February, there was nothing. And it's now April, and you've got such a large tumour. It's just come from nowhere. And for me, I think that was the biggest blow, of knowing how big it was and how aggressive it was. Because my original cancer was so aggressive anyway. This is now even more aggressive. And I think that was the hardest bit for me.
I bet. And so did they have a plan for you then at that stage?
Well, I ended up staying at hospital all day that day. So I went in at, I think it was like 9:30, 10 o'clock in the morning. And they told me, obviously, the cancer's in your hip. And I had to ring my mum from the hospital to tell her, because they wanted me to stay at the hospital all day. They wanted me to go for bloods. They wanted me to go for more scans. And I thought, well, I can't just ring my mum now and say, actually, I've just got to stay here for a few more hours more. Right? It's like, she's going to. And we kind of, me and my mum and dad had already sat down and had the conversation a few days before, because I was that convinced that it was in my hip. I already knew. So when I rang her and actually said, it's in my hip, she was kind of just a bit like, all right, and just give me a ring later when you want me to pick you up. And I think that was just because she kind of already knew. And I think it was just her way of blocking
process. And dealing with it.
And obviously when I got home that night and we all sat down and we had a bit of a cry, and me, my sister come round and stuff, but up until that point, I think it was just her way of dealing with it. She was just like, all right, and I'll pick you up later. But yeah, that's exactly.
I guess for her, it's probably just really hard for her to process that,
Yeah, yeah,
wasn't
completely.
it? So you
It's just,
stayed in all day that day, and
yeah,
then
yeah.
did you go home with any kind of plan of action, or was it
Um,
a
no,
while?
not really. I went home and they kind of said to me, I kind of did and I didn't, I guess, because they told me that my hip was so at risk of fracturing that I needed surgery straight away. And what they were going to do is where sort of the ball of your leg is, they were going to put a nail straight through it diagonally.
Yeah,
And that kind of takes away the risk of it fracturing because of how it
yeah,
sits. The
yeah,
nail will sit in sort of
yeah,
your socket and stop it from
yeah,
moving in place. Um, so as far as I was concerned, I was coming home that day. I was waiting for someone to ring me to say, you know, you're going for surgery tomorrow, because they were saying
yeah,
it was going to be that quick.
yeah,
And then after that, it would just be either more chemo. I didn't quite know what it
yeah.
would mean.
Mm.
And my consultant said to me before, if it comes back, there isn't really much that we can do with regards to treatment. And she kind of
Right.
spoke about surgery, but what I didn't realise is she was actually talking about if it had come back to my cervix, whereas we're actually talking about a secondary now. So my cervical cells have actually
Yeah.
moved places and now grown a tumour elsewhere. Whereas if it had come back in the cervix, then it would have been meant sort of a hysterectomy and things again.
Would
So
that have been a more positive outcome if it had come back in your cervix?
yeah, I think so.
I
I
guess
think
it's a bit like if you have secondary breast cancer, it's very different to you having a localized recurrence. I think that's
yeah,
still treatable, isn't it? But it's when it spreads to other organs or other parts of the body that
yeah,
that it changes into an advanced diagnosis, doesn't it?
yeah, yeah. And for me, my consultant had told me that the worst place for cervical cancer to go to is the bones. And it's not
Mm.
just the worst place, it's the, what's the word I'm looking for? The least common place. And it
Oh,
does
is that
typically go
right?
to the bone. I think it tends to go to sort of bladder, bowel, because they're obviously right next to
Close to each other.
the cervix
And
anyway.
do they say that it's the worst because it's harder to treat, or that it's because it's painful, or
Um,
what?
I think both, to be
Both,
honest.
right?
It is harder to treat, and just because there's not as many cases happening,
Option,
so they
right?
haven't
Okay.
any sort of research, and they haven't got
So
as much knowledge, I guess.
yeah. So if you had a tumor there in the socket, could they operate on that? Could they remove that tumor, or was it too entwined with the bones and everything?
Um, Mine was removed, and from what I can gather, as long as it isn't sort of too advanced and too far into the bone,
Mm,
and they
mm,
can, even if it was in the socket, they can remove that as well.
right.
Because if you have a standard hip replacement, they replace the sockets as
Yeah.
well, I think.
Mm,
So you just think, from the ball and socket side, I've only really had half a hip replacement because I've only had
mm,
the hip replaced. But then when you think about, because my cancer was coming halfway down my thigh bone, so they had to
right.
actually replace half of my thigh as well. So
Right.
it's actually turned out to be more extensive than a hip replacement,
Right.
um, just because of how much they've had to replace and
Mm,
how much muscle they've had to cut and take away
mm.
and stuff like that.
But are you more comfortable now you've had that surgery? Because that was a lot
Yeah,
of pressure on your hip, wasn't it?
yeah,
So it feels a bit better.
yeah. I can't describe the pain of bone cancer. Um, I have got a really high pain threshold, and
Mm.
the girls always laugh at me because when I broke my hip last time, I was actually on a hen party.
Somebody commented earlier, Sarah,
I,
saying it was alcohol induced,
yeah,
and
it
I
was.
thought, oh, I don't want to say that in case somebody's just having a joke.
No,
She said she's like a whippet now.
Oh no, I won't go that far. Yeah, I was basically on a hen party and I was getting out of the hot tub, and obviously the steps and the floor was wet.
Ah.
As I got out, I kind of just slipped on the decking, and
Oh no.
you know, we went from standing and landed on my hip, and that broke. And the girls always joke because that was like the Friday night, early hours of Saturday morning, and then the Saturday we were going out Saturday night. So I just took, 2 paracetamol, 2 ibuprofen.
Wait, you didn't go to the hospital?
No, no. Put my dress on, put my heels on, and went, we were in Chester, and I went dancing on the dance floor in my heels, and
that's commitment.
Yeah, we didn't actually realise till Monday. I did it on the Friday night, and on the Monday, I was kind of saying, "Oh, this isn't really getting any better. I think I need to go get checked out." And when I told the consultant what I'd done, he was bemused. And I haven't got a low pain threshold. I've got a really high pain threshold.
No, you must do, yeah. but you're saying that the pain of the bone cancer, despite your high pain threshold, was just through the roof.
It was horrific. I can't describe to you the pain.
No.
In the end, I couldn't even put my foot on the floor because it was that painful to do so. I couldn't do anything. And when they did the biopsy, oh my God, that was the worst. So they do the biopsy while you're awake, and it's basically just a drill and a hammer and chisel.
Oh my God.
To chip away
into your hip
of the bone, basically. But they don't just go into the hip, they go into the site of the tumour. So they're basically, when you're awake for this, it's CT guided. But yeah, I'd say the biopsy was the worst pain wise, and then the bone cancer's second, definitely.
Wow. So the treatment you're having, so now you've had the biopsy done.
Yeah.
What treatment have they now put you on?
So the biopsy confirmed that it was from my cervix, which is what we always knew anyway. But at the same time, when all this was going on, I'd actually found a lump in my boob, and that was new for me. God. But again, that was all through sort of other people on Instagram. Like, I never really used to check my boobs before. Like, I did, but every now and then I wouldn't check them very often. And obviously you make friends with people on here, and you get people, and it was actually Hattie was one of
Hattie Gaynor
here who had cancer, and me and my friend actually watched her video before I'd even had any symptoms and before I was even diagnosed. And I think, like, me and Casey just lay there and we watched Hattie's video, that very first video, and I remember thinking, oh, it's in her lymph nodes. Oh, bless her, it's in her lymph nodes. That means it's really bad. And then everything that came after that, and then obviously all the education and everything that I've learned, it's made me realise that actually just because your cancer's in your lymph nodes, it's not a death sentence. It doesn't mean they're really bad. And there are things out there that can help. But I'm going off on one now. I can't remember what
but go back to so you found a lump on your boob.
Yes, that's it. Yes, I found a lump on my boob. So actually, whilst I was going through all this, another option was, well, your boob could be another primary, and you could have breast cancer where it's actually bone mets from your breast cancer.
Right.
So that was
okay.
It might not be cervical cancer, it might be breast cancer, and it might be that's caused the secondary in your hip. And just dealing with all that information was just, oh God, it was massive. It was so overwhelming. And you think, not only have I just gone through cervical cancer and treatment, I've now got a lump in my boob, and I've also got a tumour on my hip where they don't know whether it's from my cervix or from this lump in my boob.
So did they biopsy the boob?
Well, they ultrasounded it and they could see that it was fluid filled, and they were really happy that it wasn't a tumour. So they left it, and they said if it causes any problems, because I didn't even know it was there until I felt it from examining myself.
Yeah.
I wouldn't have even known that it was there.
Right.
So they said in the future, if it does start to sort of cause me any trouble, or if it starts to grow or starts to become painful, then they can drain it. But it's not causing me any trouble, so I've just left. But yeah, that was obviously another thing at the same time that was driving me sort of to just.
And is that gone now, that lump?
Still there. It's still there. It's not growing. It's not moving. It's the same. I still check it because I check myself every month now. So I still check it when I'm feeling, and it's the same. So I'm happy to just leave it there, to be honest. I think I've been through enough without another needle in my boob.
Oh my God, tell me about it. So you had the biopsy, which confirmed that it was in your cervix. So then what were they sort of saying to you?
So they kind of said from the biopsy, they can see that it's come from my cervical cells. So they knew it was a secondary from my cervix. My cervix at this point, they scanned as well, and it wasn't there. My cervical cancer had gone. So they'd actually cured my original cancer. So
they cured the primary.
That's
it. It had metastasized and gone to your bone, and now it was the secondaries were sat there.
That's it.
Oh my gosh.
And my consultant.
What I don't get is why can they get rid of it there, but not if it's travelled? I don't get that.
It took so long for me to get my head around. And I kept saying the same. I was like, why have I got to go through all this surgery, learn to walk again, and everything else that comes with it, if it can just be cured the same as it was originally? And I think the way that my consultant kind of explained it to me was, my chemotherapy wasn't the treatment for the cancer. The chemotherapy, the initial chemotherapy that I had every week, was only actually there to make the radiotherapy work better. So it weakened the cells enough for the radiotherapy to work. But the main treatment for that cancer is radiotherapy. Now, because I've already had radiotherapy on my pelvic area,
can't have it
you
again.
don't know if I can have it again anymore, but with it being my hip, because it's in so close proximity, they don't know how much radiation my hip took. So they can't actually.
But isn't it then worth the risk? Because part of you just thinks, well, can we just try it? But do you feel like that, or
I just think I've got nothing to lose. You've just told me without any treatment I've got less than 6 months to live. Like, I've literally got nothing to lose. Why can't we just try it anyway? But I think the general sort of gist of things was, we'll do the surgery, we'll do the chemo, and then we'll see where we're up to afterwards. So that's what happened. So I was actually an inpatient at the time, and I was meant to be going for my surgery, and the surgery that they offered me wasn't actually the surgery that I thought I was going to be having. I did a video of it on my Instagram because there was so much to explain, because so many people were asking me questions, and I kind of got to the point where I thought that the surgery was to obviously make the quality of my life better. And my consultant said, you can't be cured of this cancer. So as far as I'm concerned, it's making the quality of my life, but with the cancer, better. And when the surgeons actually explained to me what the surgery was and what they were going to be doing, it wasn't going to improve the quality of my life. It was just going to make things better. Not better, but worse. So they explained to me that the surgery that they wanted to do was the exact same surgery as what I had, but they wouldn't have been able to put like my muscles and my tendons and everything to get back together again in a way that would have allowed me to carry on using my leg. So they said, if surgery, I'd have to physically pick my leg up to be able to move it because I'd have no control over it.
Ever.
Ever.
I'm not sure where the improvement is there, unless they're saying that it would eliminate pain. If you're in a lot of pain, I understand that, but
yeah, I just thought for me, I would have been in the wheelchair for the rest of my life.
So you did you choose not to have that then?
Yeah. So I told him I didn't want it. I said I don't feel like it'd improve my quality of life. I feel like it'd make things worse. And I asked at that point, I asked for a second opinion. So I said, you know, is there anybody that I can be referred to ask for a second opinion? And I was thinking about sort of the Christies in Manchester, because that's not too far from me. And one of the nurse practitioners actually said, why don't you go for the Royal Orthopaedic Hospital in Birmingham? Because they all specialise for, you know, bones. And the surgeon that I saw, I had an appointment on a Tuesday, and me and my mum went down. She came in with me. We met with the surgeon. He explained what he was going to do, which was the exact same surgery as what I've been offered before. But they could basically put everything back together again properly. They're like the leading surgeons in the whole of Europe.
That's amazing.
The things that they can do is phenomenal. And you know, I sort of told him what happened to me, what I was offered before, the fact that I did it, and he said to me, he said, look, Charlotte, at the end of the day, I wouldn't offer you this surgery if I didn't think it would make an improvement to you. He said, if I thought that it was going to make the quality of your life worse, then I wouldn't do it. He said, but I've done this surgery so many times and I know the outcome of it. And I know that, you know, I'm not saying you're going to run in marathons. I'm not saying you're going to be jumping, you know, you're going to have some limited movement. My aim is to get it to the point where you're able to walk with a stick.
Yeah.
And I'm confident that I can do that. And I was like, you know what? I haven't got anything to lose.
Thank goodness that you went for a second opinion. Just goes to show how important that is. Because
I just think if I hadn't gone for that second opinion, I probably would have gone with the surgery because I would have believed that that was the right thing to do.
You'd be in a wheelchair right now.
Yeah. And I'd be in a wheelchair for the rest of my life.
Yeah. So have you had that second bit of surgery then at the Christies?
No, it was just at Birmingham. So it was just
sorry, at Birmingham.
I didn't get referred to the Christies, so it was just a surgery at Birmingham. I went down there on the Tuesday, and they admitted me straight from clinic, and I had the surgery on Thursday, and it was literally that quick. But my mum had to go at that point. Like as soon as she took me to the ward, she had to go because she was only allowed in because it was an outpatient appointment in a clinic.
Right.
Whereas once I've been admitted, it was then inpatient visiting, and she wasn't allowed to do that. So she had to go, which for me was really emotional.
Yeah, I bet. So sorry, when was this surgery? When was it?
So this was, I think it was about 11 weeks ago, 12 weeks ago.
Right. Now. And how are you feeling now?
I'm getting there. I feel like the first few weeks I really improved really fast. I'm improving really slowly now. But I'm still improving, and that's amazing. And I
just got to keep at it.
Yeah, any improvement is still an improvement.
Absolutely. And are you still on some sort of drugs as well?
Yeah, so I'm still having chemo every 3 weeks. So obviously I've got all the drugs that come with chemo. Yeah. I'm still on quite a lot of pain medication, so I'm still on quite a bit of morphine, and I'm on medication to help with like neuropathy pain, so like nerve pain and stuff as well. And then I'm just on mainly like bone supplements and stuff, really. Mainly just pain relief and supplements, to be honest.
Everybody on here is just saying you're doing amazing, you're being amazing, what you've done is incredible. I am in absolute awe of your story and where you're at, and actually you know, being able to chat like this and to, you know, raise awareness that people really understand a little bit more about cervical cancer and the things to look out for.
Well, this is the thing. I think, like, for me, I'm a nurse anyway, so kind of I always want to do that sort of helping other people, and I feel like that's just second nature to me because it's me anyway, and I'm not working, I'm not doing anything. I kind of feel like that's my way.
Well, you're doing a lot.
Carrying on.
You're doing Can I just quickly ask, what are the other symptoms that you know of? So obviously the bleeding.
Yeah. So bleeding abnormal to you. So bleeding after sex, bleeding after you've been through the menopause, bleeding in between your periods, basically anything that isn't normal for you. That's sort of the main one. Unusual discharge. So again, anything that isn't usual for you, you could have discharge every day for your whole life, but when it changes, that's the point where you need to get checked out. So if it's not normal for you, then that needs to be checked out. And then just generally feeling tired, weight loss, anything like that.
Bloating, anything like that?
So bloating tends to be more with the other gynae cancers. So womb cancer and ovarian cancer is a lot to do with bloating as well.
And the last thing I wanted to ask you was about, you've got a GoFundMe on the go, haven't you? That I think your friends have set up. Am I right saying that? And what's that for, and how can people find it?
So my friends very kindly set up a GoFundMe page, and that's more for alternative treatments, so things that I can't get on the NHS. There's a lot of things, and there's a lot of things I've researched and looked into, and again, there's a lot of the research that I'm doing is more of medical research that I'm looking into. So I'm just doing a quick Google search. What else can I do? Kind of looking on Google Scholar and into sort of articles that people have wrote, and like researches, like trials that have happened and stuff. So immunotherapy is a big thing for me, and I think a big thing for cervical cancer is immunotherapy, but it's not always available in the NHS. And you have to have a certain sort of factor in your tumour to sort of
qualify to get to have that immunotherapy. I've got you.
That's the word I'm looking for.
What I'm going to do is, I'd like the link for your GoFundMe. I'll find it and I'll put it on when I post this, and I'll put it on there. And if anybody out there, you know, even if it's a few quid, it's, you know, anything helps, doesn't it?
I mean, I've got the GoFundMe link on my Instagram as well, by the way. If you need. The main thing for me is sort of raising awareness and letting people know what's normal for them, and knowing when to get help. I've learned so much, even through being a nurse. I've learned so much, and I just think, if I've learned this much, how much more could other people who aren't in the medical industry learn from me, if that makes sense. So, I will say to people, if you've got a question, if you want to ask anything, message me. You know, I'm always on my phone. I've got nothing to do. I'm always on my phone. I will always message back.
That is so kind, and you'll be helping so many people. And you know, a couple of really important things I've certainly taken away from this is, you know, that second opinion. You know, taking control of your medical destiny, you know, as much as you can, and the fact that, you know, you really pushed to get your results back sooner because you had that gut instinct. And I think it's listening to your gut instinct, isn't it, and having the balls to you know, speak out and push these things through. So listen, I can't thank you enough, and I won't take up any more of your time. So thank you so nice you're an absolute inspiration, and I just keep doing what you're doing and spreading the awareness. You know, you'll be helping lots and lots of people. So thanks again, and I'll be posting this on my Instagram, and I will put the link to the GoFundMe on there as well.
so
All
much.
right. Thank you
Thank
so much for your time. Yeah,
All
thank
right.
you. And let's keep in touch. All right.
Thank
Take care. Bye-bye. Bye. Thanks everyone for joining us.